So today I'll be talking about misoprostol use in obstetrics and gynecology, right? So let's start. All right, so let's jump right into it. So misoprostol use in obstetrics, obstetrics and gynecology, obstetrics and gynecology, right? Now, so we have three words here. We talk about misoprostol, obstetrics, and gynecology. But I want to start with obstetrics, right? So anytime obstetrics is mentioned, your mind should go to pregnancy. Your mind should go to pregnancy, birth, and then postpartum care. Postpartum care. Postpartum care. So when we say postpartum care, it is what happens after delivery, right? So pregnancy, birth, then postpartum care deals with obstetrics, essentially. And then when you talk about gynecology, you are referring to non-pregnancy related issues like menstruation, like fertility. That's what it means. Now, that being explained, let's go back to what? Misoprostol. Now, anytime misoprostol is mentioned, right, what readily comes to mind is abortion. But I really want to disabuse your mind from that, right? Misoprostol is not an abortion tablet. The fact is that misoprostol is a synthetic version of a natural chemical produced in the body called a prostaglandin, right? So there is a natural chemical that is produced in the body. It is called prostaglandin. So misoprostol is just a synthetic version of that chemical. And what it does essentially, or misoprostol is produced in many tissues in the body, but they have profound effects in the stomach and then the intestine. And what they do there is to increase, the mucus concentration of the stomach, increase the bicarbonate level, and then decrease the acidic concentration. Beyond that, they equally maintain a frictionless movement of blood around the stomach lining, right? And again, they facilitate healing and repairs of what? Stomach wall. So misoprostol, or rather prostaglandin, essentially, they are there, they play a protective role in the system, especially your stomach and the intestinal lining. But what happens when you take, certain medications like non-steroid anti-inflammatory drugs? So we say NSAID. Anytime you take non-steroid anti-inflammatory drugs, notably naproxen or diclofenac, which could be diclofenac potassium, diclofenac sodium, if you take it for a length of time, they have that propensity of reducing the mucus concentration of the stomach wall, and they increase the vulnerability of your stomach to injury, to irritability, and sometimes to ulcer. So that's what happens when you take NSAID for a very long time. So where do we bring in misoprostol? Yes, misoprostol, like I said, is a synthetic version of what? Prostaglandin. Now you have taken NSAID. NSAID has depleted what? That prostaglandins in your system, and it rolls. So misoprostol is called into play to replenish, the mucus concentration, increase the bicarbonate level, and then reduce the acidic concentration of the stomach, right? So beyond that, misoprostol, just like prostaglandins, can equally facilitate frictionless movement of blood around your stomach lining, right? And then, of course, they ensure healings and repair of your stomach wall. That being said, prostaglandin, or rather misoprostol, can equally stimulate, smooth muscles like the stomach and the intestine. Yeah, they stimulate smooth muscles. So when they stimulate smooth muscle, it leads to contraction. It is this aspect of the misoprostol that we use in obstetrics and gynecology, because they can stimulate smooth muscle, leading to what? Stomach contraction. Misoprostol can be, used to induce labor. So we use misoprostol to induce labor, right? We use misoprostol to induce labor, with live fetus. We use misoprostol to assist missed abortion, and then incomplete abortion, right? Now we use incomplete abortion. Incomplete abortion. Now we use misoprostol to actually prevent postpartum hemorrhage. So we use it to prevent, postpartum hemorrhage. Postpartum hemorrhage. We use it to prevent postpartum hemorrhage, and we use it to treat what? Postpartum hemorrhage. Again, we can use misoprostol to terminate pregnancy. Yes, we can use misoprostol to terminate, pregnancy, right? Now, that being said, let's jump right into abortion, because I mentioned that misoprostol can be used, to assist missed abortion, and then incomplete abortion. We can use it to induce labor. We can use it to prevent postpartum hemorrhage, treat postpartum hemorrhage, and then terminate pregnancy, right? So let's jump into abortion. Let's talk about abortion, and then we see how misoprostol can be used to induce labor, to assist, the different types of abortion we have, prevent postpartum hemorrhage and all that, right? So we talk about abortion. So what is abortion? What really is abortion? It's pertinent to mention at this point that in Nigeria, abortion is illegal. Abortion is essentially illegal in Nigeria. So let's talk about abortion. Now, when you talk about abortion, it's just the removal of an embryo or a fetus from the uterus. And this can happen, naturally or spontaneously, or it can be through human intervention before the pregnancy is considered viable at the age of 28th week. 28th week. That is when we consider that pregnancy is viable. So it's the removal of an embryo or a fetus from the uterus, right? Either through a natural means or through human intervention before the pregnancy is considered viable at 28th week. We call it abortion. Now, abortion classically can be divided into two. We talk about spontaneous abortion, right? We talk about spontaneous abortion, and then we talk about induced abortion, right? Induced abortion, right? Now, the spontaneous abortion is further divided into what we call, threatened abortion. Threatened abortion and inevitable abortion. Threatened abortion and inevitable abortion, right? Now, that is under spontaneous abortion. Threatened abortion is further broken down into what we call missed abortion, right? And then inevitable abortion is broken down into what we call, incomplete abortion and then complete abortion, right? Complete abortion. Now, when we talk about induced abortion, there can be therapeutic, right? And there can equally be what we refer to as criminal abortion, right? Criminal abortion. Now, let me walk you through this. When we say something is spontaneous, it happened naturally. It happened unaided. So it is the expulsion, of what? Pregnancy before fetal maturation, and it happens naturally or unaided. However, there are some predisposing factors that can lead to spontaneous abortion. We talk about chromosomal aberration. We talk about hormonal dysfunction or hormonal imbalance. We talk about abnormal sperm cells. We talk about abnormal womb. All these are, predisposing factors that can lead to spontaneous abortion. Though it happens unaided, it happens naturally. That being said, now, when we talk about threatened abortion, there are three things you put into consideration when talking about threatened abortion. You talk about what we call, you put into consideration bleeding, right? You put into consideration the cervical os and then the ultrasonographic report, right? In threatened abortion, the bleeding is always spotty, like you have spotting. There's basically no bleeding, but spotting, right? In threatened abortion. And then the cervical os is still closed. Cervical os is closed. And then when you look at the ultrasonographic report, you see that the fetal heart is normal. That fetal heart rate is normal, right? So when it happens like this, we said it is what? Threatened abortion. Now, when you talk about missed abortion, right? In missed abortion, again, you consider bleeding, you consider cervical os, and then you consider the ultrasonographic reports. In missed abortion, the bleeding is mild or there is no bleeding. And then when you talk about the cervical os is absent. And then the ultrasonographic report, there is basically no fetal movement. In ultrasonographic report, there is no fetal movement in missed abortion. Now, when you talk about inevitable abortion, again, you consider bleeding, cervical os, and then ultrasonographic reports. In inevitable abortion, the bleeding is heavy. Bleeding is heavy. The cervical os is open. That cervical os is open. And then in inevitable abortion, you see, products, protruding from the vagina. You see, product protruding from the vagina. When it happens like that, it is inevitable abortion. Then when we talk about incomplete abortion, again, you consider bleeding, cervical os, and ultrasonographic reports. In inevitable abortion, the bleeding is heavy. In incomplete abortion, the bleeding is heavy. Just like inevitable abortion, the cervical os is opened. And then when you look at the ultrasound, you see that there is an empty sac. There's basically an empty sac. There is nothing there. So we say it is what? Incomplete abortion. Now, when we talk about complete abortion, you consider the placenta, you consider the conceptus, you consider the membrane. So the expulsion of the placenta, the membrane, the conceptus, complete expulsion of these things. And then you will see that the pain will cease, and then the pregnancy signs will regress naturally. So when it happens like that, we say it is what? Complete abortion. Now, let's go into induced abortion. Induced abortion is just a complete opposite of what? Spontaneous abortion. This one is induced. It's the termination of pregnancy before fetal maturity, either through the use of instrumentation, through the use of medications, or any other human intervention, right? Now, in induced abortion, we talk about therapeutic abortion. Abortion is said to be therapeutic when it is legally and medically allowed to be carried out. In such a case, you see that maybe the life of a mother is in danger or the life of a baby is in danger. In chronic situation, when the mother maybe has cancer or kidney failure or whatever, therapeutic abortion may be allowed. But like I said, it must be legally acceptable. It must be, medically acceptable for therapeutic abortion to happen. Now we talk about criminal abortion. This is the type of abortion that happens, with no medical reason. You just carry out abortion because you want to carry out abortion. You feel the pregnancy is unwanted, but in reality, there's nothing like unwanted pregnancy. We have unplanned pregnancy, right? So criminal abortion happens when you do it not under the supervision of, when you do it, when it is against the law and against the medical ethics, we say it is criminal. That being said, let's jump right into how misoprostol can be used. Like I said, misoprostol can be used to actually induce labor. So when a woman is pregnant, in those days we use oxytocin, to induce labor. But now we use misoprostol to induce labor. So if you want to induce labor with misoprostol, this is what to use. You use induction of labor, with live fetus. With live fetus, this is what you use. You use 25, you administer 25 microgram, you administer this, right? Administer 25 microgram vaginally. use 25 microgram vaginally, and then 25 microgram sublingually. You use this sublingually, right? Now you use 25 microgram, you administer 25 microgram vaginally. You do that every 6 hours, right? Every 6 hours you use 25 microgram vaginally, right? You don't exceed 3 doses. That means you don't exceed, you use 25 after every 6 hours. You don't exceed 3 doses. You don't use it more than 3 times. And then if you are using 25 micrograms sublingually, I mean under the tongue. So what happens is that you put 25 microgram of this misoprostol under the tongue. You allow it to stay there for like 30 minutes. It is expected to dissolve. Thereafter, you can, gulp a cup of water just to wash everything down, right? So sublingually, you can do that every 4 hours. Again, you don't exceed 3 doses. If you are able to do this, you can naturally induce what? Pregnancy. Now, in place of vaginally, some people may prefer, 50 microgram. You can use 50 microgram orally too. Yeah, you can use 50 microgram orally instead of 25 microgram vaginally, right? Now, if you are using 50 microgram orally, again, you repeat every 4 hours, and then you don't exceed 3 doses, right? This is how to induce pregnancy with live fetus. Now, like I said, I'm not going to tell you how to carry out therapeutic abortion because it is against the law. And it is not in my place to begin to teach you how to carry out abortion. So I'm going to say, okay, we mentioned missed abortion. In missed abortion, we talk about the bleeding. The bleeding is mild or there is no bleeding. The cervical host is absent. And then when you look at the ultrasonographic report, there is no fetal movement. So in such a case that it has been confirmed that the fetus is no longer alive, I can assist the mother to naturally expel, the whatever outside. So in such a case, in missed abortion, I can equally use. So we talked about missed abortion, right? In missed abortion, let's say 4 to 12 weeks, 4 to 12 weeks gestation, 4 to 12 weeks gestation, I can give 800 microgram. I administer 800 microgram, right? Vaginally. I administer this vaginally daily, OD, for 2 days. I do this for 2 days. That conceptus is expected to go out. Or instead of 800 microgram, okay, so 4 to 12 weeks. So maybe if I'm considering 12 to 24 weeks, right? I can give 200 microgram. I administer 200 microgram BD. That is every 12 hours. I do it every 12 hours until the expulsion of the conceptus from the uterus, right? I do this every 12 hours until there is an expulsion, right? Instead of this again, I can equally use for 12 to 24 weeks, I can use 400 microgram. Again, I use 400 microgram every 4 hours. I use it every 4 hours until there is an expulsion, right? Now, in missed abortion, this is allowed, right? I can comfortably give you this. Now, let's jump to incomplete abortion. Again, in incomplete abortion, we talked about what? There is heavy bleeding, right? The cervical host is open, and then we talk about empty sac. So there is no living fetus in the baby. So we can, in the body, so we can assist, the pregnancy. We can assist, the woman to actually expel whatever that is left in the system. So in such a case, let's do it here. We talk about, let's talk about incomplete abortion. Let's talk about incomplete abortion here. So we talk about incomplete abortion, right? In incomplete abortion, let's say 4 to 12 weeks of gestation, I can give 600 microgram. I give 600 microgram. Remember, in incomplete abortion, there is heavy bleeding. So you don't use the vaginal route, right? So you can use 600 microgram, administer 600 microgram orally, administer 600 microgram orally, or 400 microgram sublingually, right? In incomplete abortion, you can use this, right? This is what you use in incomplete abortion. Now, when we talk about prevention of postpartum hemorrhage, that is bleeding after birth, right? You can use, so prevention of postpartum hemorrhage. Now we can, what we do in prevention of postpartum hemorrhage is to give 600 microgram, we administer 600 microgram orally, and then 600 microgram administer orally, right? Or sublingually. We use it orally or sublingually, right? We use it orally or sublingually. Now, if you are treating postpartum hemorrhage, if you want to treat postpartum hemorrhage, so treatment of postpartum hemorrhage, in the treatment of postpartum hemorrhage, treatment of postpartum hemorrhage, here you can use 100 microgram, administer, rectally. You can administer rectally, and then you use 200 microgram orally, 200 microgram orally, and then 400 microgram sublingually. Sublingually. Now, this is how to treat postpartum hemorrhage. 100 microgram administered rectally, that is through the anus, and then 200 microgram orally. You can swallow 200 microgram orally, and then you use 400 microgram sublingually, like I have explained what sublingual means. So it is under the tongue. You are expected to allow the tablet to be there for like 30 minutes. And then after the 30 minutes, you can gulp in whatever is left. So today, I've talked about how misoprostol can be used in obstetrics and gynecology. I've explained what obstetrics means, what gynecology means, and then what misoprostol means. I've talked about abortion, and then I've equally talked about the different types of abortion we have, and how the different dosage of misoprostol that can be used in treatment or in the treatment of, either incomplete abortion or missed abortion, or how you can use misoprostol to prevent postpartum hemorrhage or to treat postpartum hemorrhage. So, thank you.